Hello! Today I want to discuss some tips for medical professionals and audiologists who are working with parents of deaf or hard-of-hearing children. Now, many may be wondering, do we need to educate medical professionals and audiologists? Aren't they the experts in their field? Well, it's true that they are great at working with children who they're trying to integrate into the hearing world. They don't have the best resources and tips for helping parents who are trying to integrate their children possibly into the deaf community. Now, generally, though, medical professionals and audiologists are there to provide parents with information and resources for the child. That way, then, the parent can then make the decision. So it's important that medical professionals and audiologists have a good understanding of the deaf community and the options in the deaf community in regards to language and culture, in order to then give the parents the option of whether they want to take the step of going towards the hearing realm or the deaf world. And it's really important that parents have that decision and those resources to make, as they are responsible for that child's life. Now, as we go into this, I want to start with, why is this an issue? How do medical professionals and audiologists not have enough knowledge? So as we've seen, when deaf people go to to a doctor's office or an audiologist, they often face some barriers. Some of those barriers include communication and cultural barriers. When a deaf parent goes to the audiologist or a doctor's office with their deaf child, they face a communication barrier because they don't speak the same language. That parent signs an ASL, and most of the time, most doctors do not understand ASL. So there's that communication barrier, and often a lot of things get miscommunicated because neither the doctor nor the parent knows what's happening. Now, thankfully, due to the American with Disabilities Act, it is required now that patients are given an interpreter whenever they go to the doctor's office, that an interpreter is provided. Now, even when the interpreter is provided, there are still issues. One common issue that has been found is that the interpreter and the doctor will dialogue together, and the doctor will not acknowledge that the deaf person is in the room. They will not acknowledge the parent or the patient. They will tell the interpreter, and the interpreter will tell the patient, but the doctor will not talk to the patient. Another issue that is really an issue, and it's really problematic, is that sometimes the interpreter is not qualified. They're either not qualified to be an ASL interpreter, or they may just not be qualified to interpret medical information. They may not have a good enough understanding of medical terminology and stuff in order to interpret between ASL and English. And it's important that the interpretation is accurate, as that can be a life or death situation, and that parent and that patient needs to know the proper information, otherwise there could be severe consequences. Another issue that is often happens between the audiologist or the medical profession and the patient, the deaf patient, is that cultural barrier. Because medical professionals and audiologists are not trained and they do not have exposure to deaf culture, they do not understand the culture, and then they don't understand the views of deaf people, and they don't have the right resources for them. So oftentimes the hearing will view deaf people as broken. They view them as needing to be fixed. That's not how the deaf community views being deaf. Being deaf simply means that they can't hear. That's it. So when they go to the audiologist, if the parent has a deaf child, a lot of times what they'll find is that they'll face discrimination. If the parent is deaf, they will face discrimination and oppression. The doctor will not want to work them with often. And a lot of times too, for hearing parents with deaf children, when they are coming to them for help and resources and to figure out what's best for their child, they are not given any of the options of being part of the deaf community and learning sign. They are only offered speech therapy or maybe the option of a cochlear implant. And that's not right. Now, I want to discuss the role of the parent in this, because it is the job of the medical profession, the audiologist, to provide these resources for the parent, because the parent's main role in this is making that decision for that child. They are the ones that are going to kick off that child's learning, kick off that child's language, and they need the resources to figure out how best to do that. So when medical professions and audiologists are working with those parents, they need to be providing with all the resources. They need to know of the resources within the deaf community. And the best way for them to do that is for the medical professional, the audiologist, to connect those parents, whether it's a hearing parent or a deaf parent, usually it's the hearing parent though of the deaf child, to the deaf community. Generally, the deaf parents are already integrated in the deaf community. They understand ASL, so they're able to help that child gather a language, gather community, gather culture. Those hearing parents generally have never associated with another deaf adult or person. That child is their first deaf person they've associated with, but they need those connections to the deaf community and other deaf people to help aid that child in learning ASL and becoming part of a community. Other resources that could be good for them is connecting them with other hearing parents of deaf children who chose the route to integrate that child into the deaf culture and to learn ASL for their child and teach their child ASL. Those would be adequate resources. And these are the resources that should be provided to parents who go to the audiologist and find out their child is deaf, especially the ones who have never experienced working within the deaf community, because they need those options to decide what's going to be best for their child. And so in order to do that, medical professionals and audiologists need to understand deaf culture, and they need to understand these resources themselves. Now, one resource that was put out there, it is called My Deaf Child, and it was from a hearing mother who had a deaf daughter, and she experienced trying to figure out the right resources for her daughter, and she went through different struggles and trials to figure out what's the best. So she and some others put together this website, and she explains about the struggles she went through and then provides the resources for these families to learn ASL and to get connected with the deaf community and some early intervention programs. So that is a wonderful resource that deaf and audiologists should be recommending to other people and also for them to learn from. Now, what I want to talk about is what medical professionals and audiologists should be recommending as resources for these parents, as well as not only for the parents, but these should be resources for them to be able to learn and then be able to tell them. So the first resource is called Beginnings. It's in a corporation called Beginnings, and it's an organization that helps professionals who are working with deaf or hard of hearing children and their parents to give those parents those resources they need. Now, one thing that this website talks about is in Individualized Education Program, IEP, and this program is for hard of hearing or deaf children with special needs. Now, many may be thinking, if you're part of the hearing community and you don't have exposure to deaf culture, well, they're deaf, they are special needs. No. They simply cannot hear. These are for children who are deaf who have mental or physical special needs. This is not just for those that if they're deaf. So this is a great program for them that they can be a part of. And the website discusses the meetings that these parents can go to learn more about it, what the meetings discuss. It tells them who should be going to the meetings. And the medical professionals and audiologists should know this information because they should be providing it to those parents. So they need to know who should be at these meetings, what the meetings are about, so that way they can tell these parents, this is what the meeting's about, this is who needs to go for your child. Additionally, it also talks about the application process for those who are going to be part of the program. And again, the medical professionals and audiologists should have this information so that they can give it to the parent. That way the parent knows what they need to be doing when they fill out this application. Now, on the side as well, we have another resource, and it is from Gallaudet University. It's from the Clare National Deaf Education Center, and this website here has many, many resources. This one is a website, and it pulls resources from all different places, and it just links them all there. So this is perfect for audiologists to study all the different resources and to have them condensed into one list to be able to give to parents. Now, this one not only has resources for the benefits of ASL, why children should be part of the deaf community, and how to introduce parents to that, but it also has actual programs that the parents can be a part of for their child, the parent-child and parent can be a part of, and things that they can do with their child. And these are excellent programs that audiologists and medical professionals should have in order to give to those parents. Your child is deaf. These are the programs you need to get started with. One of them is a VL2 parent information packet. And this packet provides parents with lessons to teach their child ASL while they learn ASL too. That way the two of them can connect that language. Additionally, that packet has interviews of hearing parents with deaf children and their experiences. It also has interviews of people who grew up deaf and how they were bilingual and how that benefited them. The next resource that I have here that medical professionals and audiologists should know of is a program. It's an online program for parents, again, to aid that child, and it's called Language in Motion, Family Supports and Early Intervention for Babies Who Are Deaf and Hard of Hearing. Now, this program has 7 modules in it, and it's meant for early language acquisition. So this is great for parents to begin that language for that child, because it's so critical that they have a language and they have exposure to language as soon as they're born. And if they can't hear, that language is not going to be English. That's not going to be their first language. They need ASL to aid them in that. The final resource that medical professionals and audiologists should be using is from the National Association of the Deaf. And on here is a web page, and it is for hearing parents who have newly identified that their child is deaf. And it goes through and it talks about different programs that they can be a part of, different ways to get associated with the deaf community, why ASL is important, and it just kind of introduces all of that to them. So this is a great one for parents, but it's also important for audiologists and medical professionals to read, so that way they can understand the culture and what these children should know and what they should be exposed to. That way they can take that knowledge and then give it to the parents. So all these resources are important for medical professionals to know themselves, but also then to recommend to those parents. So that way they have options. Again, these medical professionals and audiologists are providing parents with the resources necessary so that they can go further and make the best decision for their child. And they need as many resources as possible to do that, because it's a very critical decision. So now that we've talked about that and how some tips for medical professionals and audiologists and what they should be implementing in order to best accommodate integrating people into the deaf community, why does it matter? It matters because many deaf children grow up, they are isolated, they don't have a language, they don't have culture, or they're trying to be shoved into the hearing community through speech therapy and cochlear implants, when that's just not the best option for them. When we have a language that is accessible to them, the ASL is so accessible to them, it's meant for them. They have a deaf community where they see peers who are like them, they have deaf role models that are like them, in order to build them up and make them successful human beings in society. And it's important because in order for them to get to be that successful human being where they're strong and confident in their deaf identity, it starts at the bottom when they were born, and then they go to that medical professional or audiologist and they explain to that parent your child's deaf. But then if they don't give that parent the right resources to aid that child will not grow up to be successful, or they will have many struggles along the way. So it's important that medical professionals and audiologists understand this, so that way they can aid those parents and those parents can best aid those children. So I hope from this that many will see the changes that need to be made in the medical profession and audiologists, and that they need to be trained better in deaf culture and ASL, and the importance of deaf children and deaf babies having exposure to that and what that means for their lives. I hope that those viewing who are not part of the medical profession or are not audiologists, if you are a parent, that you are able to use this information maybe for your child who is deaf, or you're able to share it with family members or friends who need to hear this information. And for those who are not parents either, and you just come across this, I hope that this is an enlightenment to the changes that need to be made in our society, and the ways that you can then share these tips with others and share these tips with those who you know in the medical profession and who are audiologists. Thank you.